Miss Noorah.
Thank you, Ms. Dima. Assalamu alaikum. Can you hear my voice? Ms. Dima, can you hear me?
Yes, we can hear you very well.
Assalamu alaikum. My name is Noorah AlTobaishi. This is our graduation project entitled of a pilot study to evaluate the effectiveness of hyaluronic acid on gingivitis, done by me and my colleague, Fatma bin Saeed and Maha Al-Fudayli, and supervised by Ms. Fatoon Al-Khalifa. Alhamdulillah, me and my group, we was lucky, and we present this presentation in the first Alumni Day for Dental Hygienists in 2019, and we present it as a poster in EDIC 2020. Firstly, we want to declare that there is no conflict of interest regarding the conducted study and the product used. Hyaluronic acid is an antimicrobial ingredient that is naturally occur in the linear polysaccharide of extracellular matrix of connective tissue, synovial fluid, and other tissue. It has anti-inflammatory, anti-edematous, and antibacterial properties. It has been used in dental field to accelerate healing process and decrease tissue disruption, reducing gingival pocket following closed or open root planing, and reduce bleeding in a preoperative stage of tooth extraction and during the removal of sutures. It's considered to be safe to use, with no evidence of cytotoxicity has been found. It's safe to be used on children, pregnant women, and elderly individuals. The aim of a study is measure the effectiveness of 0.2% of hyaluronic acid gel with oral hygiene instruction compared to oral hygiene instruction alone in reducing plaque-induced gingivitis. Our hypothesis: there is no significant difference between participants receiving oral hygiene instruction alone and participants receiving oral hygiene instruction with hyaluronic acid. Our study design is randomized single-blind control study and within-subject approach. Participants were collected by sending an announcement, including a survey on social media. This is the survey that we sent it, the announcement. Our target group is medically fit female in age between 90 to 27 who diagnosed with the plaque-induced gingivitis and with gingival index score 2. Our exclusion criteria is a smoker, pregnant woman, participant who had antibiotic within the last 6 months, participant who had a prophylaxis treatment within the last 3 months, dental student and dental professional, and participant who had appliances. Participant exposed to both control and experimental approach by splitting the mouth in two parts, right side including quadrant 1 and 4, and left side including quadrant 2 and 3. Each side exposed to different modality, either oral hygiene instruction only or oral hygiene instruction with a hyaluronic acid. Sides are selected by the participant preference. The intervention tools was given to the participant, which contain ultra-soft toothbrush with 5,460 rounded filaments in one level, fluoridated toothpaste, and we make sure that it didn't contain an antibacterial or anti-inflammatory agent, dental floss and cotton applicator, and 7 sealed bags of hyaluronic acid gel. Each bag contained 1 ml of the gel. The oral hygiene instruction was to brushing twice a day using modified bath technique with B size of fluoridated toothpaste and flossing once a day. Hyaluronic acid use instruction was to use 1 bag of hyaluronic acid gel by cotton applicator once a day in the chosen site and avoid eating, drinking, and rinsing for 1 hour. The participants signed the consent form after checking inclusion and exclusion criteria. This is the picture of the consent form. Then we take the baseline clinical indices, which contain gingival index, bleeding index, and plaque index. The hyaluronic acid application and oral hygiene instruction was explained and supported with a printed instruction for reinforcement. This is the printed instruction that we give them, and the main investigator were applied for the treatment protocol until the results were analyzed. After 7 days, the clinical indices were recorded and reassessed. Statistical analysis done by SDHS program, we use a cross-tab test for descriptive data and paired t-test for preliminary data. B-value equal and B-value less than or equal 0.01. A 44 response we received, and 38 of them were excluded according to inclusion and exclusion criteria for this study. Our participants were mainly college students in age between 22 to 27. This is the baseline indices at the hyaluronic acid and oral hygiene instruction site. And this is the baseline indices at the oral hygiene instruction site. There is a reduction in both groups in all clinical indices, while hyaluronic acid with oral hygiene instruction group has significant reduction with high coloration and a bleeding index. B-value equal 0.007. This is the t-test between the baseline indices and after applying hyaluronic acid with oral hygiene instruction. As you can see here, it's high coloration. The coloration here is 0.98. And this is the t-test between the baseline indices and after applying oral hygiene. Hyaluronic acid with oral hygiene instruction site shows statistically significant reduction with high coloration and a bleeding index compared to oral hygiene instruction alone. Similar results found in Nidger study, which showed a significant reduction in all clinical indices. However, Nidger contrasting the present study in plaque index and gingival index, in which those indices had no significant reduction. Another study done by plaque, the result shows no significant reduction in plaque index. Same results found in this study. There was a reduction in all clinical indices for both groups, most probably due to several factors, and one of these factors is individual left or right-handedness. 80% of our participants right-handed with better hygiene care on their right side, and 20% of them left-handed with a better hygiene care on the left side, which contrasting Adnan study who reporting that right-handed individuals provide better hygiene care for their left side on their mouth, unlike the left-handed individual provide better hygiene care for their right side. The present study showed no side effect of using hyaluronic acid in dose 1 ml once a day for 7 days, neither observed clinically during the post-treatment examination nor reported by the participants. The results showed a great influence in reducing plaque-induced gingivitis. Therefore, the study highly recommended the clinical utility of hyaluronic acid gel on regular basis and to be practiced on the oral hygiene instruction for all plaque-induced gingivitis patients, to be included in dental hygiene educational program since it has been proven to be highly effective in plaque-induced gingivitis therapy. Also, a modification on the study design need to increase the randomization level. Site selection need to be randomly selected rather than the participant preference. Results could have been influenced by the following limitation. The sample size was small due to limited implementation time. The policy of Dental College Department in King Saud University stated that only female patients allowed in girls' campus to be treated in dental clinic. Therefore, male participants were excluded from the study, as well as the clinics were available only for a specific time, which affect participant scheduling. The randomization level of the study design got affected by allowing the participant to select sites. Moreover, the study included 3 researchers, which may affect interpreter reliability. However, researchers have the same level of educational background, which enhanced the study reliability. Also, lack of literature available in Saudi population considered one of the major limitations. For future study, a replication of this study with larger number of participants would provide stronger evidence supporting the pilot study, measure the effectiveness of hyaluronic acid among different patient categories, such as smoker, diabetic, and orthodontic patients. Measure the effectiveness of hyaluronic acid among non-plaque-induced gingivitis, comparing the effectiveness of hyaluronic acid gel extracellular and intracellular with other anti-inflammatory agents and adjacent to scaling. In conclusion, the present pilot study is the first of its kind to evaluate the efficiency of topical application of hyaluronic acid among Saudi population. Hyaluronic acid administered by the participant for 7 days with no adverse side effect observed clinically or reported by the participants. The results conclude that usage of 0.2% of hyaluronic acid gel with oral hygiene instruction is more favorable approach in treating plaque-induced gingivitis with high significant improvement in bleeding index. Thank you.
Interesting topic. Please, if anyone has any questions, the chat is open for you to add your questions. A few attendees are writing, so we'll just wait a few minutes. while we are waiting for questions, I have a question for you. Miss Noorah? Please unmute your mic, Miss Noorah.
Yes.
Yes, my question is, if you were to do the study again, what would you change in the design?
I would not apply the participant to select the site. I would be it randomly.
And
Because
why would you do that?
it will be affected because patient we choose the if they choose it, they will take the easier for them, and this will affect the study. And I want number.
Yeah, to be random. Great answer. Thank you. We still have a few more minutes if anyone has questions for Miss Noorah. Could you please stop sharing your screen?
Okay.
So we have a question here for you. One person is asking Miss Hiam that you mentioned your study design is single-blinded. Who was blinded in the study?
The main investigator, the oral hygiene instruction and the site selection who give them, it is another person.
Okay, thank you for the clarification. And while we're waiting for any more questions, I would like to thank you, and on behalf of the Saudi Dental Hygiene Society, I would like to present this certificate of appreciation for your valuable contribution to the first conference.
Thank you. Thank you.
We still have a few more minutes, so if anyone has any questions, we are waiting. Please write in the chat. As we were waiting, I'd like to tell everyone that Miss Noorah AlTobaishi and our next presenter are both students of mine, and I'm really glad that they are presenting at this conference. And I'm really happy to see the support of interns and students in this conference, and of course, our professionals.